Good afternoon. I am happy that you join our afternoon session. I hope you enjoy the conference. You are interested in the topic because it is about us, nothing without us. Now we start a regional meeting. It's a meeting where we should know more about the problems, about tasks in our regions. I am very interested that you give your input. So first there will be a short presentation and then we can answer or decide what is the most important for Africa, what is important for Europe, for Asia. So I hope it will help us. I will be a speaker, and Regina Namata Kamoga, she didn't receive visa. She lives in Uganda and she has a chain organization. She is very active. She just did a regional meeting for Africa, and we have recorded speech of Regina. Please.
I'm delighted to be here. My name is Regina Mariam Kamoga, the ED for Chain and a founding board member of the World Patient Alliance. The WPA organized the first regional Africa meeting this year in August. This meeting was against the background that patients across the world face healthcare challenges, but particularly patients from Africa have very unique challenges and specific challenges, hence the need for WPA to organize its first regional meeting in Africa. This meeting was organized by a very dedicated team from Africa, from countries including Uganda, Kenya, Tanzania, Rwanda, Nigeria, and Zimbabwe, who made sure that they come up with a very comprehensive program for the day to have a successful meeting. The event theme was raising patient voices as a pathway to quality and safe care in Africa, focusing on creating pathways for achieving universal health coverage. Why did we choose universal health coverage? Like I said, patients in Africa face unique challenges at the systems level, as well as patient level, including the double burden of communicable and non-communicable diseases, poor access to healthcare in terms of proximity, availability, affordability. As you can see, 615 people in Africa can't access essential services. They don't have trust in the healthcare system, and many actually seek services from traditional practitioners, which many times turn out to be unsafe for them. They face the double burden of communicable and non-communicable diseases, and as you can see, out of the 17% of the world population, 23% of the global burden falls on Africa. And many use their out-of-pocket for healthcare, resulting to 11 million Africans falling into poverty, as well as other challenges, including low literacy, paternalism, very low budgets and lack of priority for health, human resource capacity challenges, weak regulation systems, and many other challenges. So it was against that background that we focused on Africa and universal health coverage as a whole. We had over 9 hours of online engagement, convening and empowering over 100 patients from patient organizations and key global development stakeholders. 14 key presentations were made from patient organizations, as well as global private and public sector health agencies promoting UHC. The event was organized in 2 sessions. one focused on global interventions, as well as the other one focusing on case studies on patient safety across Africa from patient groups. Resources were shared on the framework of actions for universal health coverage. We had a number of speakers from across Africa, as well as Europe and the US. The team at WPA, which was led by the chair, Andrew, the ED, Hussein Jeffrey, and myself, who led the coordinating of this successful meeting. Our speakers, coming from the different parts, made presentations focusing on what they're doing on universal health coverage. Dr. Ernest from Ghana shared with us the universal health coverage intervention in Ghana. We all know that Ghana is far ahead in terms of implementing universal health coverage. So Ernest shared their work in Ghana. We had Lorraine from Farm Access, who also shared about strengthening the infrastructure on a supply chain and how they engage using an ecosystem approach, engaging public and private sector. We had Gertrude from WHO, who shared the global action plan and WHO efforts. Janet from Africa Union, NEPAD, also shared about how they strengthen primary health care and skilling of community health workers. Catherine from Max Foundation also shared their 25-year of accelerating health equity in memory of Max, who died at 17 years of leukemia. Since then, they have spearheaded sustainable solutions to cater for medicines and treatments for cancer patients. We also had patient organizations sharing their case studies. We had Irene from Tanzania, rare disease, Christine, and others from South Africa, depression and anxiety group, sharing their work on patient engagement and empowerment, ensuring that patients are empowered, patients are their own champions and are able to make decisions and demand and advocate for healthcare, which is safe. We had both long-term and short-term goals, because we looked at this not only as a one-stop, one meeting, but we're looking at having a critical mass of patients through collaboration and constant engagement come together to identify their needs and be able to build the capacity. So in the short term, we're looking at strengthening a network of African continent patient advocates. We're looking at creating the WPA Africa Regional Membership Steering Committee to build the capacities of patient organizations to promote safe care. We're looking at holding personal and in-person and online quarterly empowerment meetings. And in the long term, we want to support the strengthening of the capacities of patient organizations. We know that these organizations have challenges, including financial inadequate capacity in different areas that hamper their full participation in terms of advocating for safe and quality care. So we would like to strengthen their capacities. Then creating an online information sharing and knowledge management portal for tracking the progress of UHC interventions, as well as having constant collaborations and working together. So we're looking at WPA working together with patient organization, the WPA members in Africa, to ensure that we create a critical mass of empowered patients who can engage fully in terms of advocating for safe care, as well as ensuring that they are able to participate at the different levels as equal partners. So what is the key message? The key message is, in my language, we say, agali awamu ge galu menyama, teeth that is together is what bites the meat, because we believe and we recognize the fact that when we work together, when we come together, we can definitely achieve patient safety and quality care, because we believe that patient safety and quality care is possible. So together with WPA and the patients as well as the other key stakeholders, we would like to continue working together to engage the Africa patients to ensure that we can achieve universal health care and safe care. Thank you.
I will tell a little bit more about the problem and region information about what we should do, what we can do. As you have seen on Andrew Spiegel's slide, we have now even not 374, but we have 378 organizations. Yesterday, we just approved 4 new organizations. As we discussed on the board meeting, till the end of this year, we want to have 410 organizations. I hope we manage this. We have 114 countries, and we represent all disease areas. So we are a good organization for every region. But my region is Europe. As you see the numbers, in Europe we have 109 organizations, in Americas 101, in Africa 90, Asia 64, and Oceania 10. What we should do for our members to be more attractive? As you know, Europe, WHO has 53 countries in European region. We have now 33 countries, so 20 countries are missing. I am so happy that now we have even people at WPA from Kyrgyzstan, or we have from Estonia. So we have very different countries among our members. These 109 organizations, of course, they are mostly from these countries where English is the most spoken language. As you know, in Europe, it was not always common to speak English. Even my English is poor because I was educated in the country where Russian was an official language. So this is the situation that even for my organization, many people who came here, they speak partly English, and we translate each other to other person because they are old, and I cannot now tell them with 60 or 65 start to teach English. So language is a big limitation in my region. As you know, the Europe is from UK, so these English-speaking countries, we promote our ideas, and people very voluntarily want to join us. But they are French-speaking countries, and like France or Belgium, and these people, we don't have much organization. So we try as much as possible to translate in the future materials in Russian or in French or Spanish, and then we will be more attractive as an organization. But we, as you know, we are a very young organization. We just have 2 years. So 2 years, boy or girl cannot see and know everything. So we are growing, and we will be every year better. So the main idea is to represent patients across different region. As you know, people in Kyrgyzstan, in Kazakhstan, in this Far East have another problem that people in Germany. In Germany, they spend so much money for every patient that we cannot compare the healthcare system, the health assessment to different medicine in different even part of our region, Europe. So we need to adjust our materials, our information, webinars to different part, even in one region. So this is the first point. Another point is that in every country in Europe, for example, in European Union, we have a common regulation for healthcare for countries like Poland or Spain or France, because it is the same European regulation, and it allowed us to use in emergency situation in every system on the same level. So this is not a problem. But in Europe we have also big Russia, we have Ukraine, we have Armenia, Azerbaijan, and their health system is not same like in this European Union countries. So we need to promote a collaboration between governments and between organization, policy maker, that people will receive really a good quality of healthcare. So this is our goal, to provide the highest quality healthcare and products for patients. Once I was a few years ago in the US, and I noticed one medicine for cancer. If they have a new medicine, there is in 3 or 4 months implemented for treatment for patient. The same medicine in Poland could be introduced in 1 year, and in Germany in next 6 months. So you see how big difference, and is 1 year in cancer. This is a lot of time. So we should, as all patient organization, as patients, we should push our governments that on the same level should be the healthcare in every country. And what we should include in the agenda of World Patient Safety Day, we should be every time promoting this patient safety, because it is a very general point. This patient safety means patient safety, good medication, good healthcare, good diagnostic. And in this action plan 2021-30, we should have all challenges which WHO promote. We should include in our project also. As I mentioned in my previous presentation, telemedicine, mobile, new technologies covered now the world. So we can use these technologies to inform patient about the data of consultancy, or we can have the list of medicine which this patient take. So we can use in different way the communication, this new communication with patients. And what is also promoting for many years by WHO, the main pillar is the family doctor. They know that if you have a good nurse, the good family doctor, you are in good protection. So we also should promote this good communication, because this family doctor knows all about you. And good communication with doctor, a good health literacy from this doctor is very good. What we can do as WPA, we can do this education via webinars. We can organize different meetings across specific disease area. We can teach people how to change lifestyle. There is a new project, lifestyle medicine, and we can promote this among people that they start activity, Nordic walking, Tai Chi, anything, that they move, that they do this 10,000 steps a day, what protect our heart, that we teach people how to eat better, how to control better sleeping time, etc. And what I want to do next year, and this is my idea, and I hope we manage to do this, we should organize a regional meeting in Europe. Because, as you see, even during this conference, we know names of people, of speakers, you know these people, but we know them from computer, from our webinars, and now we have a chance just to talk. You can find the organization which deal with same issues like your organization. So Africa can change with organization the ideas in Europe or in Asia. So that's why I think it is important that we do these regional meetings step by step, like it was in Africa. Now it's time for Europe. We will have also another region. We have not much organization in EMRO region, so we should do there. And of course, Asia. Asia is very important because we have people there, and they need to have more information and education from our side. So I hope if we will have money, we can do it easily, even next year, 2-3 meetings. And I would like to thank you, and you have Facebook, Twitter, LinkedIn of our organization. If you know that some organization didn't join us, you can promote because it is free of cost, and of course we support as much as possible. For example, for this Patient Safety Day, we did a grant. I don't know exactly, but 10,000 or 11,000 we gave to different organizations, and this organization had money to buy T-shirts or organize meetings, small conferences, small meetings to promote this idea of patient safety. It is from 2019, I think WHO established this Patient Safety Day, and really many people promote this idea, and many people heard this patient safety. You know, when I met Susan in 2006, I think she was an icon of patient safety, and nobody in my country knew what is to properly wash hands or do not one injection. They sometimes did 2-3 times. Or I used to be a journalist, and in one hospital it was Klebsiella pneumonia. 50 newborn died, and nobody treat this as a special thing. So in this almost 20 years, it has changed everything. And I think this new normal is also our change of thinking. This is now another word. So that's why I ask you all to promote this idea among our organization and among patients and our friends, because it is really important. Thank you. Now I would like to invite Carla Ruiz de Castilla. She is a board director of What Patient Alliance. She is also director of this conference committee, and she will tell more about South and Latin America.
Thank you, Yolanda. So in Latin America, we have a lot of challenges. This was a dream that becomes true a few years ago. We are the World Patient Alliance. We had a meeting in US, and then we started growing with all these patient organizations joining us today. This first World Patient Conference in Rome allowed us to share experiences not only in our region, in our Latin American region, but in the whole world. And as Yolanda said before, we are growing for every kind of diseases area and every continent. In Americas, we have 101 patient organizations. And if you see on the map, we have almost all countries covered. So this is a great notice for us. And World Patient Alliance principles, as Andy said before, are access to healthcare for everybody, patient-centered healthcare, financial hardship, empower patients, patient safety and quality, patient education and information, partnership and collaboration, patient engagement, and non-discrimination. In Latin America, we have challenges as we don't have early diagnosis, for example. In my organization, we work with cancer patients. So more than half of the patients arrive to the healthcare system not in the first stages. And for example, we have no biomarkers. No biomarkers are used for diagnosis, for example, lung cancer. So if you don't know which is the name and the last name of your lung cancer, you cannot access to innovative care. We have delay in the approval of innovative medicines. For example, between 10, 18 years of delay. In Peru, we have a case for breast cancer that we had a delay approving a new drug of 18 years. No investigation for rare diseases in our countries, no interest for bringing care to no-COVID diseases. Before, we were talking about non-communicable diseases, and I think the most of our governments are seeing only COVID, only the pandemic, and the other pandemic is the patients that have no access now to diagnosis and no access to continue their treatments. So sharing best practices in the region and of the world is a key for achieve universal health coverage. And we're starting this in this, our first World Patient Conference right now. And I want to say thank you to Alba Robles, thank you to Migdalia also, and thanks to the Latin Americans coming here. I know it was a long travel to come, and thanks also for joining in virtual and for starting this movement. I think we have so many challenges, but the civil society can change the healthcare system. And as Dr. Arora said before, we know about what's happening in our bodies, and we are partners, and we can start this movement for changing and trying to have better healthcare systems. Thank you so much for joining, and I don't know, Yolanda, if you have something else to present now? I think so. Yes?
Now I will open the floor for discussion, because we don't have, if you like voluntary to come from different regions, from Africa or from Dr. Arora from Asia. So I invite you here, and we can share our few ideas about what we can do together, how we can fulfill expectation of patients. Please, we have a seats. Please, can you come? We just to talk, or you prefer that I come with the micro to you? What is better? Yeah? Hello? Yeah, this is the correct one. Yes. I will ask Dr. Arora first, here on the stage or here, what do you think about your region? What is the most important for you to do, and how we can help as World Patient Alliance in making this came true.
Thank you. I think it's okay from, let me see. I think you all understand and know that Asia is the most thickly populated continent. See, whatever you see in the whole Europe, there is much population in India itself than the whole Europe. So, and especially India, Pakistan, and Bangladesh, they are very thickly populated. Though in our India, it is in the constitution, the health for all, but due to less funding and crunch of resources, this is not possible right now. However, in recently 2018, our government started a policy to help the 40% poorest of the poor people, and they said that around $6,000 will be given to per family, irrespective of the family size, whether the families of 1, 2, or 5 people. One family will get around $6,000, and that will cover everything, whatever they like. And every year, it is not for one time, every year they can have benefit of $6,000, which will cover diagnostic, prevention, treatment, surgery, 3 days prior to the admission and 15 days post discharge. So this they have started very recently. But the only problem with that is, see, this is based on 2011 census with the poorest of poor. Means only those are covered, those who don't have anything. Means they don't have their house, they don't have any even two-wheeler, four-wheeler, three-wheeler, they don't have any male person in the family to earn, or all person, or only disabled person are able. So though it is benefiting and it is, you can say, helping the poor of the poor, they don't have to spend from their pocket, but that is available to very, very poor. So it is not that should be what we are asking to the government. Even recently we had 2-3 meetings with the government very recently, and we are asking it should not be restricted to those persons who doesn't have even food to eat, or don't see that they require it, but it is even not affordable by the middle class as well. So we are trying for that as well. So as far as in other countries, you see, even see Pakistan or Bangladesh, even their health services are not very good. Nepal is totally dependent upon us. Even Bhutan is not so well off in the healthcare sector. You can say China is still better, or maybe even Thailand is still better than our India or Pakistan, Bangladesh or so. To improve this healthcare management or healthcare services, how World Patient Alliance can help us. I think I heard that there has been a recent meeting with the African people, and then the European, they had it. I think we can have, because we can have in India, say for Asia, because India is a central place, and the still resources are much better than other countries. So we can have this next year meeting at India, but certainly to raise funds is a problem. And if WPA can afford us, so we can start it. And regarding this, to involve the patient, I'll always repeat, see, unless until the patient is empowered, you are not going to get anything. In simple words, a mother doesn't give milk to a baby unless he or she cries. So you have to cry. So if you want to cry to get from the government, you have to be educated, and you must know what you want. See, at times what happens, the organization goes with the big things. No, not at all. You first ask, I tell you my example as well. See, there was a medicine for this, see, with the repeated blood transfusion, extra iron deposits in the blood. So there was a medicine called Desferal injection, which was very costly. It was available only in European countries or Western countries, and we were importing that. So once I went to the Secretary Health, I said, we want for this. He said, how much it will cost? I say $100,000 for 1 year. He said in $100,000 we can cure or we can treat diarrhea with just 1 rupees, which is just 1/80th of a dollar. So why should I spend so much money on few patients and why not to a whole population? So then the new drug came into India for this. That was very cheap. So we started asking for, okay, you give us for this drug. After 2-3 years, I said, okay, you give us this. After for few times, we ask for this or this. So slowly and slowly, first you must ask which is feasible for the government. Never ask the big things in the one go. Ask very small things, and when you get to that, then you ask more. So my strategy has been such that now we have facilities available almost all over India, few states, except 2-3 states are there where these facilities are not there. Otherwise, blood is free, medicine is free, and but still there are challenges. In government sector, we never get regular medicine. There is a break in supply here, depending upon the funding and all these things are there. So my again and again request is engage patients, empower patients, educate patients. If patient is educated, only then you can achieve that. That's my thing. Thank you.
Thank you very much, Dr. Arora. Now I will transfer the micro to Hannah, or Hannah can take this. Hannah is from Lebanon. Lebanon belongs to Emro region. As I said before, we have not many organizations in this region, so I am very, very happy that we have 2 people from Lebanon. Yes?
Yes. Ahmad.
Yes, and you are from the same organization or
No.
different? So maybe he would like to add when you said us about the problems in your region, in your country.
Yes.
Please.
Thank you. Thank you for the chance to present our NGO. So I founded Said NGO. It's the only organization in Lebanon and in the MENA region specifically dedicated to raising awareness about colon cancer and offering free screening for this preventable and treatable cancer. Thank you for first the Global Colorectal Cancer Association with Andrew and the World Patient Alliance for this opportunity to showcase our cause. Because in Lebanon, we've been for 3 years, we've been passing through a tremendous decline in everything. In economic crisis, we had a big explosion that everyone has heard about it from and we had the banking system put their hands on all our monies, so we don't have any money. And thank you to once more to GCCA Global Colon Cancer. We only have one funding event in March. It's a walkathon, and its title is March for Colon Cancer. So we convey 3 messages in this event, and thank you once more because they helped us to do this event. And if you have time, maybe tomorrow we can run the video. It takes 2 minutes, just to show the participant how was it.
Yes.
It was a great event, thank you. And so we invite the whole the people present here to help us in this event to be a global event because it was very successful. We could do 3 missions. First, we spread the awareness about the importance of walking, of healthy lifestyle. It prevents from many diseases represented in this place. And secondly, it highlights that March is colon cancer month. In Lebanon, it wasn't known, and in many countries also, it's not known. And then we all wear blue. This is our color, the royal blue. So and there were many messages of awareness in this march. We could involve more than 900 people to walk and to advocate with us for the awareness. And now we are in the process of advocating with the Ministry of Public Health in Lebanon to launch, hopefully, I don't know if we will succeed, maybe with the help of the people present here, to the first organized screening program in Lebanon. So we will do a pilot study next month in one village, in one place, and then we will show the results to the government and show them how we can replicate it in many places. Thank you.
Thank you, Hannah. I would like to know more about, we know that Africa needs everything. Our friend who couldn't come here, he told me once when I was in Uganda, she showed me the pharmacy. Pharmacy, it was just like a small shop. In the small bag, she received 4 or 5 tablets just for migraine. She has very, very often migraine. Without any leaflet, without any original package. She just received 4 tablets for migraine and 2 another tablets. So I was really shocked. If we talk about the safe medication, safe pharmacology, in Africa, we need really a lot of work. Another issue is I went to the hospital. It was a hospital in Kampala. And in this hospital, I am not talking about devices, but as you know, in Africa, if you have breast cancer, this is similar like in South America. You have 2 or 3 public centers for chemotherapy, radiology. So people sometimes go 1-2 days to reach this such hospital. So we know this issue are generally in this continent very difficult. But our organization doesn't have enough money to help to buy medicine or to buy devices. But what we can do as patient representative, as patient advocate, to whom, how we can organize our declaration, our request to governments, to Minister of Health, what we can do as patient organization. What do you think? Beautiful ladies.
Hi, my name is Ikuya Sapo. I'm from Ghana, and I work with Lifeline for Childhood Cancer. We raise awareness on childhood cancers in Ghana, which is quite big. It's a big issue. It's a public health issue in Ghana. In Ghana, of course, a developing country, patients don't have rights like in developed countries. It's not normal. I mean, in a country where we don't have universal health coverage, childhood cancer is not even covered under national health insurance. Rights is just a luxury for patients. So it's very important, like Dr. Aurora said, that when patients are equipped with knowledge to even understand what their rights are, to know what the possibilities are, then we begin to have a conversation on how well to support patients and how well patients can be at the center of their treatment journey. Awareness is key for whichever illness. Awareness is key, and I guess support in different areas would certainly make a difference for patients to even have a voice to get on the journey. So yeah.
Thank you. I'm Pamela Odalo from Kenya. I work for Hope and Life Cancer Support Group. And just as she has said, we come from a developing country where many facilities are not available. Like personally, when I was diagnosed with cancer, I had to be traveling over 100 kilometers to access medical facilities. And as we know, with third world countries, not many of us can afford that, because you have at times to stay even a whole week before you get treatment. Universal health coverage in my country was rolled out in 5 counties as a pilot project, but it was not properly funded, and I would say it has not picked up. Secondly, the level of poverty is very high. And if I would talk of cancer, which I work with, once you're diagnosed with cancer in my country, it's almost a death sentence because the treatment is expensive. We hardly go for checkups, and you only realize you have cancer once you're down. I was diagnosed with cancer almost at stage 4, and it is because I had a COVID attack that lowered my immunity, and then I started feeling pain and had to go for medical checkup. Otherwise, maybe I would not have made it. So many people are diagnosed at a very late stage, and then they are so poor, they cannot afford the tests involved, they cannot afford the treatments involved, and most of them, especially women who suffer breast cancer and ovary, they are most of the times neglected and abandoned by their spouses because it involves so much. And I think if we partner with the WPA, advocacy is very important, being aware. Another thing is maybe getting to these policy-making bodies. Because fine, I may have an idea from such a conference, but how do I reach my government so that the ideas that I'm getting in this forum are implemented? It ends with me and my organization and the people I work and interact with. Thank you.
Thank you very much for all this upset information. But you know, it is incredible in Europe to know that people who have cancer, they don't have painkiller. And in Africa, people with cancer really don't have this absolutely medicine which is generally in every pharmacy. But what I wanted to say, as WPA, we started our official status with World Health Organization. She said we need to be aware and we need to give our voice. Our voice should be heard on international fora. Because, you know, I had similar situation like she has in Africa, I had in Poland. Once I came after our meeting, Patient for Patient Safety, many years ago. It was my Minister of Health on this meeting in London, and he told me, what is this patient safety? For what we have this? It was nothing for him important. It needed many years, even in Europe, to change thinking. And I think as a big organization with big members, we can always promote what we want on WHA or during any regional meeting. So our voice must be heard on very, very top level, and then it could go down, because if they have a challenge, we need to wash hands, or we need the proper medication, or we need safe surgery. These challenges are implemented step by step in every region and in every country. So today we had many messages, starting from Dr. Aurora and from Hannah and from you, that our patients should be aware, should be empowered, should be engaged, and they should be very, very well educated. If we don't have this education, if we don't have this strengthened in the community, you know what I like in Africa? When I first visit my friend Regina, she always pick up me with a car, and I told her, why we not walk? She told, oh, I am not used to walk. We don't have a special paths for walking. It is danger. It's better to go by car to the next place. So she was not used to do any physical activity. And it was a time Michelle Obama showed how she do activity. You can't imagine. She next time when we were in any hotel and it was a swimming pool, she always asked me, Yolanta, like Michelle Obama, we do a fitness today. So if we have a good authority, if we have a good promotion for activity, for lifestyle changing, we also can educate people and give them a good example. Thank you. Who else wants? You know, in Europe, we have also Kyrgyzstan, which is very, very far. And I am interested if they also can say us what they expect from What Patient Alliance. Okay. They want tomorrow tell us more about this. She wants to add something. What is your name? Yeah.
So, hi, good afternoon. We are from Malta, the National Alliance for Rare Diseases support, but also the Marigolds Foundation. So basically, we represent the founder, which is the Marigolds Foundation. It's an umbrella foundation. We support different programs on health, on education and social programs. And in that respect, we are the key leaders of the Pink October Movember campaign, which is currently, we are holding this big campaign on our islands, moving from one place to another, raising awareness on female cancers. In our case, Pink October is not just breast cancer, but it's also cervical and ovarian cancer, and Movember, which is male health, in November on testicular and prostate cancer. And then, as a foundation, we also founded the National Alliance for Rare Diseases Support. Mariella is the secretary. We are over there a patient-based group. We've got families who are our members, but also other NGOs, such as rare blood disorders, ALS, MS, different groups. We are, of course, an island, very small, only 500,000. So whoever happens to have a rare disease would actually be the only person on the island going through that ordeal. So we support these people individually, but as a group, we advocate for their cause. We are part of Eurordis, we are part of Rare Diseases International, and we are now sitting on the ECOSOC Committee for Rare Diseases at the United Nations. And we are very happy that last December, in December 2021, we passed the resolution so that persons with a rare disease are actually by 2030 should be on the same level as any other patient. So as Simona Bellagambi here from Italy, she is our one of our partners in Eurordis, said rare diseases patients are effectively patients as well, but they are also going through other hardships. Now, just imagine, you are on an island, barely 500,000, and you are the only person going through that rare disease. Even our doctors wouldn't know what that rare disease is. So we have to advocate with doctors themselves to see whether the family doctors, the doctor who that family would actually go when they are being diagnosed, whether he knows what a rare disease is, or whether he is interested in knowing, because some of them are not really interested, you know? So even diagnosis is most often not easy. So we are going ourselves into, one of our campaigns is going through to pharmacies, local pharmacies. We work with local councils. So we go into the villages and we talk to the local doctors there and to the local pharmacies, just in case they know of someone, they refer him to us. And then, of course, if he is diagnosed with a rare disease and he becomes our member, then we try to help him to access services. In our country, thankfully enough, we have a very good health system, where the health system is free for everybody. And We are giving free medicinals, free treatments at our hospital. But then, yet again, where rare diseases are concerned, are these available, especially in that particular rare disease? And that is where we are asking for equality and equity, because we don't want to differentiate between patients. So right now, a patient with cancer, for example, with a certain type of cancer, which is not real, like say for example, breast cancer. In that case, we're giving treatment, we're giving medicines, full treatment, I must say. We are very lucky, as I said, even certain expensive medicines are for free in our country. But if somebody gets a rare cancer, like some of our members, they are giving nothing except symptomatical treatment to treat symptoms, make them more comfortable, make them, approach it with more confidence maybe, and maybe we try to link them with other platforms. But we are still asking, is that equality? And that is why our NGO focuses much more on this, and we are very happy to be here and be part of this World Alliance and try and learn from everybody around this room. Thank you very much for the opportunity.
Thank you very much. And I think it is a good lesson. Not only the patients should be educated, but also the doctors. And it's common, exceptional for rare diseases that very often even family doctor doesn't know what to do with the patients. Who else? The last. Yeah, we have only 5 minutes, so just Dr. Arora, and if somebody will add something very short, I will give.
I have a suggestion for you. I think there must be some genetic specialists, genetists, who are doing the genetic test on rare diseases. So you can do one thing, involve 1 or 2 genetists, and then take their help. See, you have to, after all, butter that particular 2 or 3 doctors. Okay? Then have the meeting with the pediatricians, because mostly genetic diseases are diagnosed at the early childhood or say at neonatal stage. So if you have a meeting, instead of going to everyone, you must take into confidence to 1 or 2. Maybe you may not be find more than 3, 4. You take just 1 or 2 and have repeated meetings with them and ask them for CMEs, that continuous medical education. That will be helpful. And secondly, for the pharma companies, we are preparing enzymes or medicine for that. They will be happy to support your activity.
Sorry, I just forgot to mention something regarding digitalization. In Lebanon, when the COVID started, we came up with an idea of spreading awareness through WhatsApp. So we discovered that not many people have Facebook or Instagram or social media. So we created a group of awareness, and the first year of COVID, we could reach to 9,800 people. But with the snowball effect, the second year we could reach 65,000 on WhatsApp group only. So that's the effect of COVID was that we didn't stop our activities of awareness, but we went virtual, and we could still spread our messages. And regarding awareness to patients, it's true that that awareness is needed. We do awareness, but the problem is that when people go for screening, we offer them the FIT screening. It's easy, it's cheap. But the problem when we have positive results, they come to us for colonoscopies, because unfortunately, not like the lady, we don't have any coverage, neither from the government, even the medical insurance companies, they charge a lot of money, and the middle class in Lebanon has been erased by this crisis, and that's the problem. Thank you.
Thank you to all participants. Thank you for your input, and we give the voice to our chair, Andrea Spiegel.
Thank you. Thank you, Yolanta, and that was such a great session. And those conversations can continue throughout the conference, beginning at 5:30, 6:30 tonight. You have the next hour off to go refresh and search for fresh water somewhere on this earth, because I don't think you're going to find it here anytime soon. But I don't have an update, actually, but I don't know. But in 1 hour, we will have a great reception with food and drink that will be sponsored by the Partnership to Fight Infectious Diseases. And you will come back here. Don't go out there where the food and drinks are. We're going to have guards all around them to make sure you come in here first. It'll only be about 10 or 15 minutes. It's a really important presentation on antimicrobial resistance. I almost got it the second time, AMR. And a very short 2-minute video. A couple words will be spoken about it, and then you can go all eat and drink. So we'll see you back here in 1 hour. We hope you enjoyed today. For those who are online, I'm happy to report that our registrations have now hit 590 today. So thanks to all of you, thanks to the staff, thanks to the conference committee, thanks to everybody involved who I'll all be thanking tomorrow. But we've hit 590 participants from 95 countries. So this is great news. We will see you all in 1 hour, and we all continue the conversation. Thank you all.